Good morning, everyone. Thank you for being here. I'm happy to deliver some promising news about the current landscape in the COVID-19 pandemic here in Oregon. Daily cases and hospitalizations are slowly coming down from the record highs we've experienced over the past several weeks, an indication that Oregonians are once again stepping up to fend off this virus. But our ability to sustain this hopeful progress and ultimately regain the upper hand over the coming weeks is dependent upon getting more adult Oregonians vaccinated and all of us continuing to wear masks when we're in indoor public places, when we're outdoors amongst crowds, and reconsidering our plans that put us or others at higher risk of getting COVID during this time. That said, I want to emphasize that this latest surge is far from finished. The Delta variant remains a formidable threat in our communities. We are still totaling more than 1,000 COVID-19 related hospitalizations each day. These capacity levels are not sustainable. Our healthcare system remains under significant stress. The newest data aligns with the latest modeling, showing that daily cases and hospitalizations appear to have stabilized after peaking around the beginning of the month, and we're projecting a gradual decline over the next several weeks. Here's a sampling of that data. As of yesterday, our 7-day average of daily cases was 1,949. That same average on September 1st was 2,200. We're seeing a corresponding drop in percentage of positive tests from about 11.9% to 11.5% over the same period. Our most recent COVID-19 weekly report for the week ending September 12th tallied 12,997 new daily cases, an 11% decline, which followed a 10% drop in cases the previous week, after 8 previous weekly increases. COVID-19 related hospitalizations fell by 42%, following 6 consecutive weeks of increases, and COVID-19 associated deaths declined by 30% from the previous week. These are positive trends, but we need to keep up the pressure against the virus. We know from our experience in this pandemic that a slippage in our resolve can quickly erase these hard-won gains. Only by getting vaccinated and by staying faithful to the public health intervention can we ensure that there will be enough available beds for everyone who experiences a medical emergency. We are seeing another consistent trend in the data. Unvaccinated people continue to account for an overwhelming majority of COVID-19 cases, hospitalizations, and deaths in Oregon and across the country. Let me repeat that. Unvaccinated people are getting sick. Unvaccinated people are being hospitalized, and unvaccinated people are dying at rates far higher than those who are vaccinated. The data shows, and the supporting science finds, that the available vaccines are effective shields against serious illness and death from all of the COVID variants. If you think you're protected by COVID-19 because you've already had the virus, know this. The data show that people get even better protection by being vaccinated, even after they've recovered from COVID-19. I urge everyone who is eligible for vaccination to take advantage of this life-saving opportunity for yourself, for your families, and for your communities. Let me briefly address our approach to ensuring that our schools remain well protected against COVID. Last week, I promoted the testing programs that are available. Testing is important, but as we said before, we cannot expect to test our way out of the pandemic. OHA continues to work closely with the Oregon Department of Education in adopting a multi-layered approach to ensure that our schools remain well protected against COVID-19. Every layer matters. Every layer helps keep students in class. That means vaccinations for those who are eligible, physical distancing, hand and cough hygiene, face masks, smaller cohorts, ventilation, air filtration, staying home when you're sick, and other measures our students and staff have learned and practiced over the last 19 months. With COVID-19 cases high in our communities, we are seeing more students and staff needing to stay home while they recover or after an exposure so that spread in schools can be minimized. With these measures in place, What we are not seeing is much spread of COVID-19 in schools. We are confident that if our schools implement the new Ready Schools, Safe Learners protocols as designed, we can achieve the delicate balance of promoting the safety of students and staff while minimizing their risk of catching the virus in school and bringing it home. Adherence to these protocols is critical to accomplishing our shared objective of ensuring that schools can reliably hold in-person education every day for every student all school year. And when, as we hope happens sometime in the fall, the federal government approves vaccinations for children under 12, we plan on making these vaccines widely available in clinics, community health centers, pharmacies, and locations throughout communities. We recognize that vaccinations for this age group could significantly increase vaccination rates, providing us with the momentum needed to decisively contain this virus so we can all get back to doing the things we love and miss. To everyone who has taken the time and effort to get the vaccine and now to wear masks, thank you. Your shared commitment is working to blunt this latest surge and is saving our hospitals. Let me conclude today by sharing a personal observation. Earlier, I recited the numbers and trends for recent cases, hospitalizations, and deaths. I want everyone to think about what these numbers represent. Each number or a point on a graph represents a fellow Oregonian. They may be sick at home with family members caring for them. They may be receiving life-saving treatment in a hospital from skilled but exhausted healthcare providers. Their loved ones anxiously waiting for updates and hoping for good news. They may have died, with loved ones gathering to share their favorite stories and coming to the realization that they may never see their mother, brother, grandparent, niece, uncle, or best friend again. This grief has become far too common, but it has not gotten any easier. Every morning, I sit with the new data from the day before. Sometimes I cry. Sometimes I get angry because much of the disease we're seeing now is preventable, and I wonder, what could I have done to reach even one more person to get vaccinated and take steps to protect themselves? Some mornings I'm numb to the pain of the suffering and death that the numbers represent. A mother or father, a son or daughter, brother or sister, grandmother or grandfather, a best friend, a neighbor, a beloved coworker. Every one of them was loved, and every one of them leaves behind grieving loved ones. Every morning I wonder, what could we have done to get them vaccinated? What questions could we have answered? Was there a place in the community they trusted that we could have directed them to? Were they basing their decision on misinformation that we could have combated? If they were still adamant about not getting vaccinated, what information could have convinced them to take other steps to protect themselves? I sit silently with these thoughts every morning. Going through this experience day after day drives me to work even harder to defeat this terrible enemy that has taken so much from all of us. I know the same is true for my public health colleagues across Oregon who are facing the tragic outcomes of COVID-19 that continue to plague us all. I long for the day when we can put this terrible pandemic behind us, and I hope that we never forget the personal tragedy and the pain that is extracted from all of us. And with that, I'm happy to take questions.
Thank you, Dr. Sidelinger, for sharing that story. All right, we'll start with Pat Doris, KGW. We'll open up the mic for you to ask the first question.
Well, thanks. Doc, so double question. Number one, what are your concerns about the new Mu variant? And also, what do you make of younger people dying in Oregon than we've seen in the past? Thank you.
Thanks, Pat, for those two questions. The Mu variant is a variant of interest that has been identified. Again, we identify these variants because we think they may cause more serious disease, transmit more easily, or evade or elude our current treatments, the monoclonal antibodies and vaccines. Right now, we're not seeing Mu spread across Oregon. What we're seeing is that the Delta variant continues to dominate. with over 95% of the detections in recent weeks being from Delta. So the pattern continues, and we need to continue the fight. Our vaccines work against Delta and what's circulating here in Oregon, and so we need to continue to get vaccines into arms, wear our masks, and take other steps to protect ourselves. If Mu does take hold, we'll have to see how that behaves in a highly vaccinated community and in communities that are less vaccinated, and see if this spreads as quickly as Delta. But for now, it's not gaining a foothold here in Oregon or in most other states. As for younger people dying, I think, it's tragic to see these deaths every day. We're seeing far too many people dying every day. We know that almost all of these deaths are preventable because people who are fully vaccinated are much less likely to die. We are seeing younger adults and middle-aged adults dying at numbers that we haven't seen earlier in the pandemic. And this represents, tragedies for those individuals, the families and loved ones they leave behind. Delta really is a different enemy. It spreads far more quickly than previous versions of this virus. It is causing far more serious disease in those who are unvaccinated, leading to hospitalizations and deaths at levels we haven't had to face throughout this pandemic. And that's impacted people in the prime of their lives. It's taking people from us far too early. Every Oregonian life lost is a tragedy. But as we see younger people dying from this disease, that just compounds the tragedy that we know families and loved ones are facing. So, I urge everyone to please use the tools in front of you. If you're not yet vaccinated but eligible, make a plan to get vaccinated. Talk to your family members, talk to your loved ones about getting a vaccine, and link them to a provider or another trusted source that can give them information. Wear your masks, limit your gatherings, and rethink the activities you're participating in right now. The life you save could be your own, that of a loved one, or a stranger. But together we can get through this and we can combat the tragedy.
Thank you, Pat. And now we'll go to Gary Warner, EO Media. Gary, go ahead.
Hello, Dr. Sidelinger, and thank you for your time today. Two things, if I could. First of all, early on, the OHSU forecast showed that after the long drop in hospitalizations, that it was actually going to go down to near zero. There was some talk about herd immunity and things like that. I'm not seeing that anymore on the chart, and I'm wondering what the situation is going to be like in Thanksgiving time and in December. And then the second question is, we're having a number of major events going on right now. The Pendleton Roundup, 50,000 people out there, masking questionable. We have the universities all coming back next week. What are your concerns about those kind of events and what they're going to do to the state? Thank you.
Thank you, Gary. Let me tackle the first question first. So when we look at modeling and do projections out into the future, this is not us trying to tell the future. We're not fortune tellers, but trying to see based on how the disease is behaving, the tools we have in place to fight it, what we think may happen over the short and medium term. And as we get further out, we have more uncertainty there. I think what we can say is that this surge appears to be kind of near its peak, coming down slightly. We're not out of the woods and we need to continue fighting, but we will get this peak to come down. How far down? We don't know for sure. But what I can say with almost certainty is that we will be facing this virus in the fall and the winter. Whether it's a resurgence of the Delta variant, a new variant, whatever form of COVID is in front of us mixed with influenza, we will see increased cases and increased need for hospitalization in the fall and into the winter. So I can't predict if that'll coincide with Thanksgiving and the end of the year holidays, but I do know that we'll probably all be considering celebrating a little differently. We may have smaller gatherings. We may shiver a little bit outside in the cold and have our Thanksgiving dinner there the way we did last year. The vaccines offer great protection and offer the ability for us to gather a little more safely, but they don't completely reduce the risk. So I can't predict what we'll be facing, but be prepared, to start new holiday traditions, to celebrate with families in possibly different ways, but hopefully we can prepare to celebrate in an almost normal fashion to what we did in 2019 and before, if we have low rates of disease and high rates of vaccination. But we need to be prepared for all the possibilities. As for events and return to college campuses, you didn't mention return to K-12 schools. Every opportunity that brings people together also is an opportunity for the disease to spread. And that's why we ask people to get vaccinated if you're eligible. That offers you and the people around you the best protection against this virus. Adding a mask on top of that when you're in indoor public places, outdoors and crowds offers an additional layer of protection. And when disease rates are spreading as fast as they are right now, rethinking the activities you participate in are very important. So many events have adopted a policy where they verify vaccination status before attendance at the event. That's another layer of protection that can be used for some of these large events. Our college football teams have used that here in Oregon. As students return to college campuses, those campuses have worked very hard to protect those students, the faculty and staff on campus, and the surrounding community. They've put measures in place to assure masks are worn in indoor settings and outdoor crowded places. Many offer testing. Many are promoting vaccination for those who have not already been vaccinated, and many require vaccines for those students returning to campus. All of those are layers of protection that should help minimize the spread and offer protection to everyone in the community. So I think together we have to take measures to try and combat the risk that these events, that these gatherings on college campuses, that the return to K-12 schools offer, because we can't stay shut down forever. We know that vaccines and masks and some common sense rethinking of what we're doing are our best tools to combat this virus. We're going to have to live with this for the time being. This is going to be with us through the fall and the winter at least, if not beyond. And these tools will help us combat that, will help us be able to still celebrate the joyous occasions with our friends and family, grieved with loved ones, go to our favorite restaurant or bar in the community, support a local business, attend some of those fall festivals that we missed last fall. We should do so with safety in mind, outside if possible, after being vaccinated and wearing a mask. But we can participate in some of these activities, but common sense prevails that while the virus is so prevalent in our community, we can't go back to business as usual. We can't let down our guard. We have to continue to fight. That's the way Oregon is going to continue to have some of the lowest overall case rates and death rates across the country. As bad as the crisis we're facing is right now, it could have been so much worse. We could have thousands of Oregonians who were no longer with us because we didn't come together to fight this virus starting back in March of 2020. Keep up the fight, keep making sensible choices, keep getting vaccinated if you're not already vaccinated, and wear your mask, and together we'll come out stronger.
Thank you, Gary. And now we'll go next question to Genevieve Room from K2.
Hey, thanks for taking this question. I have two questions, so I'll kind of break it up just so I don't overwhelm you all at once. But the first question is, we see several schools dealing with outbreaks and subsequent quarantines. Reynolds High School is switching to full CDL for all students next week. Is this inevitable? Is this what you expected?
Thank you, Genevieve. I think, as the largest number of students and teachers have returned to in-person instruction, we would expect to see more cases present themselves at school. And this is happening in the face of some of our highest case rates. That's why it's extremely important that schools have layered measures in place. Governor Brown earlier this year prioritized educators and other staff in K-12 settings for vaccine. And we know we have fairly high vaccination rates in these settings that will go up even higher as we approach the October 18th deadline for vaccine mandates in these settings. We've been very successful in getting children 12 to 18 vaccinated. Those students remain a highly unvaccinated population. Schools have invested in portable air filters, installing improved filtration in their ventilation systems, increasing the circulation of outdoor air through their heating ventilation systems or through open windows. They've continued to remind people about good hand washing, covering their cough, staying home when they're ill. Masks are worn in indoor settings across schools and outdoors in those settings where 6 feet of distance can't be maintained. We have testing available for schools to test those who are sick on campus or who are exposed on campus so they can be tested before they go home. And we also know that we now have a new tool, surveillance testing, that schools can opt into. But with all of these tools, they come up against the high amount of virus we've seen in the community. So we're seeing students and staff attend school either when they don't know they're infected or may have symptoms that haven't been tested. And we're seeing COVID-19 present in schools. The other tools we have are to have those people go home and isolate at home until they recover. But we ask folks who may have been exposed to quarantine at home. And that can mean large numbers of students from a whole classroom or a bus if we don't have assigned seating and can't fully determine who was near each other. And so during these high case rates, unfortunately, we do expect these disruptions to happen as schools reopen. But we all have a part to keep those schools open. If you're a parent or a staff member in school, think about the activities you're participating in the community. Try and lower your risk so you don't show up at school unknowingly with COVID. If you're a parent of a student, if you're a student, think about the activities you're participating in right now. Are you vaccinated? Can you do it more safely outside in a smaller group? So you reduce the risk of introducing COVID into a school while it's circulating high and potentially expose others. If you don't have a direct connection to schools, taking those activities yourself can help to reduce the case rate in the community, can lessen the likelihood that a student or a teacher may get COVID and may present to school. This is a difficult time as we go back to schools. We know how critically important it is to have students in desks, in classrooms, in front of talented teachers. They've missed out on this for most of the last year and a half. We know the measures we have in place can protect students, staff, and teachers while they're in school. And we know that the current recommendations to isolate at home or to quarantine if you're exposed can be disruptive. But if we can all work together to get case rates down, we can get through this hump, get students more consistently back into school, where we know with safety measures in place, they're going to be safe. I know you had a second question.
Yeah, so the situation at Reynolds High School, it's one of the state's largest high schools, and it is completely shutting down for an entire week. Does this seem to show that the safety measures are not being followed? From what I understand, if kids are wearing their masks, if they're 3 feet apart like they're supposed to be in the classrooms, then you shouldn't have to have these school closures of sorts, but that's what we're seeing.
Yeah, and I think multiple factors go into determining whether a school is going to move to distance learning as a whole school, a grade level or a classroom, or a smaller group of people. Keeping seating charts, whether it's in the classroom, on the school bus, limiting mixing of students in gym class or in the cafeteria or in places where people are having lunch and breakfast, can minimize the exposure of other students, cut down on the number of exposed students. As those exposures potentially go up and more people are being recommended to stay home and will need to receive some distance learning to continue their learning while they're quarantined at home, schools oftentimes will make the difficult decision that there are enough students receiving that distance learning at home that they can't deliver 2 full sets of instruction, in person to some students and remote to others. And so they may move to remote learning for all. So multiple decisions go into a school making that decision, some of them in consultation with public health, some due to the operations of the school. But we know that with multiple layers in place, we can minimize those disruptions, but we're not going to eliminate them.
And then the last question, which is quick, what does this mean for the long-term school forecast? Do you think the reality of CDL is something that will return again? Do you think that most school districts in Oregon are going to have to be doing CDL at one point or another?
So let me start by saying I remain optimistic that we'll be able to offer in-person instruction to most students every day throughout the school year. Now, optimism is not a plan. So that optimism is built on a very strong plan. The Ready Schools, Safe Learners Resiliency Framework that has been released by the Oregon Department of Education, that has been developed in consultation with the OHA, that has been developed in collaboration with our local partners in education and public health, offer really strong protective measures to protect kids, students, staff, and teachers in school and protect the families they return home to. When case rates are at their highest in the community, we are going to see more disruptions in school. But if we all work together, getting vaccinated, wearing our masks, rethinking our activities in the coming weeks while case rates are high, we can drive community case rates down. We can then drive introductions to school down, and we can drive quarantine numbers back down. That doesn't mean that if COVID surges again in the fall or in the winter, that we're not going to face some difficult decisions about moving classrooms or cohorts to distance learning, but we can minimize that by all coming together, taking precautions in the community to reduce case spread. And we know that our educators are very capable of implementing these safety measures to prevent spread in schools, to make sure that schools are one of the safest parts of students and teachers' days. So yes, we're going to continue to see this, but we can minimize that, but we all have to come together. And vaccinations are an important part of that.
Thanks, Genevieve. And next up is Lisa Balick, Coin.
Hi, Dr. Sidelinger. Quick question. What's the hesitation for OHA requiring students get a COVID vaccine if and when it has full federal approval for their age group? For example, the 16-year-olds and up right now. Why not go ahead and do that, especially what we're starting to see in others? What's the hesitation?
Thank you for that question, Lisa. I think, right now we've had vaccination mandates in place in school for decades. And, entry into kindergarten and at older age groups, there are required vaccinations that students need to get. And there's a process in place set out in statute about adding additional vaccines to that list. For right now, we haven't chosen to go down that route because we're making pretty good progress with vaccinating the students that are eligible. We anticipate additional age groups being added to that, and we'll continue to look at encouraging vaccines, offering opportunities at schools and community settings through providers to get folks vaccinated. And it may come to a time where we have those discussions about adding this vaccine to the vaccine mandate in Oregon across schools. Right now, schools under the existing statutes can choose to implement more strict vaccine requirements, can add a COVID vaccine for their individual campus, their school district. Some schools have looked at that. We've had some private schools who've added, COVID vaccine to their vaccine mandates. And so right now, we're continuing to focus on getting our staff and teachers vaccinated so they can meet the mandate of October 18th, encouraging others to get vaccinated and implementing these other protocols. And we'll keep all options on the table and perhaps look at student vaccine mandates down the road.
Thank you, Lisa. And with that, we'll go next with Fedor Sarkin, the Oregonian.
Hello, thanks for taking my question. So how many schools right now are closed to in-person learning because of COVID cases or the number of children quarantined?
I don't have the number of how many schools are closed because of quarantine. We do know that some schools delayed their opening because of cases in the community, and we've had some schools move to complete comprehensive distance learning, but we don't have, the full reports of those here at OHA.
So is that information not sent into the state, or might that just be ODE?
And again, we don't have that information compiled either at OHA or ODE on schools that have moved to comprehensive distance learning. So I can't give you that number.
Okay, thank you. So can you please tell me, how confident are you that that essentially the policy for what counts as a close contact and who needs to be quarantined is commensurate with the risk? Where on that spectrum of risk is this policy? Is there a decision to err on the side of safety, or is it well balanced, do you think?
I think that, that's a difficult question to answer. Let me start by saying the Delta variant that we're facing right now is much different than the virus we faced last school year. It is incredibly more infectious and can spread very easily from person to person. Folks who are infected carry about 1,000 times more virus in their nose than folks did with the wild type variant that we were facing throughout much of the last school year. So when we talk about close contact, it's not a perfect science. We usually think about folks who are within 6 feet of another for 15 or more minutes throughout the day. Airflow and circulation can cut down on the risk. Moving outside can cut down on the risk. And then keeping smaller cohorts to minimize exposures using seating charts in places like classrooms and buses can cut down on that, but it won't eliminate that. When virus is circulating as quickly as it is right now in the community, and we have a virus that's so transmissible, oftentimes erring on the side of caution and quarantining more people when we can't definitively say these 3 students were the only ones within 6 feet of this person for 15 or more minutes will help to minimize the risk of spread in schools. It is disruptive, but it is an additional tool that we have to prevent spread in schools. And that's why I can confidently say, and our education partners can confidently say, that with safety measures in place, we are not seeing spread of COVID-19 in schools. If we weren't identifying those who are ill and having them isolate at home, if we weren't identifying all the potential contacts that we could and asking them to quarantine at home in case they become ill so they won't spread it to others, I couldn't give you that same confident message that schools are safe. That is an important tool that's part of air circulation, masks, ventilation, and testing that helps keep our schools safe and keep the people they return to home safe, return home to safe from COVID-19.
If I could just ask one quick follow-up question. So how can you be confident or assess really how these policies or the system is working if you don't know how many schools are affected to the extent that Reynolds High School is and closing down?
Because we receive reports of cases in students and staff, teachers that are in schools. We try to make links between those schools to assess for outbreaks, and we track the number of cases that have had contact with schools. We don't always have the denominator and the full number of folks who are quarantined, but we do track the cases. And what we continue to see even early in the school year is while we're seeing more cases come to school who have COVID, who are diagnosed with COVID, we're not seeing huge outbreaks associated with school settings. And this mirrors what we saw last year. So we're tracking those numbers. The numbers are reported in our weekly outbreak report on schools, along with workplace and childcare and long-term care facility settings. So that's how I can confidently say that we're not seeing significant spread in schools and that our safety measures are working.
Thank you, Fedor. And remember, if you have questions, please send your messages to me, Delia Hernandez, in the chat, and I will get to those. Up next, and here's the full screen as a reminder for that. And next question goes to Angelina Dixon, KVAL.
Hey, Dr. Sidelinger, with all the efforts in place right now, social distancing, vaccinating, are they still working for the most part, even with the Delta variant and others?
Thank you, Angelina. I think what we know is that, the physical measures to decrease transmission work no matter the variant. So limiting our contact with others through physical distancing, smaller gatherings, and wearing a face covering are just as protective against Delta as they are against other variants. So those continue to be strong measures. What we also are excited to be able to continue to report is that those vaccines that we have right now, 3 vaccines, incredibly safe and effective, all developed before the Delta variant had come into being, still seem to be protecting very well against the Delta variant. Yes, we are seeing breakthrough cases, and those breakthrough cases increased, and that is partially due to more Oregonians being vaccinated, over 2.3 million Oregonians vaccinated. But those folks are having mild symptoms, are much less likely to be hospitalized than those who are not fully vaccinated. The people who are in the hospital with COVID right now are not vaccinated. The people who are dying from COVID right now are not vaccinated, with very rare exception. So the vaccines we have continue to work against Delta. The other measures continue to work, but unfortunately, I know we're all tired. I know we all want to get back to a time when we don't leave our house and think, did I grab my keys? Did I grab my wallet? Do I have a mask? We want to be able to leave that mask behind. We want to be able to get together with friends without even thinking, is this going to put me at risk? Am I going to bring the virus home to my 10-year-old child? Am I going to bring the virus home to my grandmother who lives with us? We all want to be in a place where we can do that, and we're not there yet. But the measures we're taking, wearing our masks, getting vaccinated, and rethinking our activities, putting in a little common sense about large gatherings right now is the way we're going to get through this. So we have the tools, they work against Delta. We just need to continue using them, even though we're all exhausted.
Thank you. My next question is, obviously we don't have any crystal balls, but with the winter months approaching, flu season and so forth, are we seeing any concerning trends yet? Anything that worries you?
I think much like last year, we are concerned as we move into flu season. What we saw this summer, not as much in Oregon, but in many other states, as measures were lifted and people got together, a virus called RSV circulated fairly widely in the summer. That's not something we usually see, but it didn't circulate much last winter. And part of that is due to the measures we had in place last winter. We weren't getting together with people as much as we were previously. When we did, we were often wearing masks. We were much more cautious about washing our hands and trying not to touch our face. So we didn't see much RSV last year. We didn't see much influenza last year, and that helped control the spread of COVID. But in the summer, we know as people kind of let up on some of those activities, RSV came back and affected a lot of elderly folks and children. That same thing could happen in the fall, that we could see influenza come back and be much stronger than it was 2 years ago. Definitely stronger than it was last year. So in addition to all the measures I've talked to you about, getting your COVID vaccine if you haven't already, wearing your mask, rethinking your activities, get a flu shot as soon as it becomes available. Everyone ages 6 months and above should have a flu shot. And it's critically important this year as it was last year, as it is in years past. If we can prevent influenza, if we can prevent COVID, we can keep hospital beds available, and we can keep people healthy.
Thank you, Angelina. And next question comes from Aaron Ross, OPB.
Hi, Dean. Thank you for taking the time to talk with us today, and also thank you for sharing at the beginning of this. I think it is sometimes easy living in an ongoing tragedy to forget that this is an ongoing tragedy. So thank you for sharing that with us. Knowing, as a couple people have talked about, just kind of this difficulty of maintaining in-person learning during a really unprecedented surge and the large numbers of students and staff in quarantine, I was wondering if OHA and ODE, and I know this is definitely a difficult decision to kind of weigh the importance of in-person schooling versus the importance of quarantining large numbers of children to help them stay safe. Are OHA or ODE considering any changes to the current policy, like implementing maybe like a test to stay or test to play program like Utah used to keep children safe in classrooms last year? Of course, that was pre-Delta, and now things aren't going so well in Utah, but they also aren't wearing masks. So that's, its own mess. Or like alternatively, is anyone considering measures aimed at reducing community transmission faster than we're currently seeing it reduce?
Thank you, Erin, and thank you for the kind words about that. I think, I appreciate all of you in getting the word out that we need to remember all of the people, all the Oregonians behind these numbers, because it really is a tragedy, and we can't become numb to it as we report it day after day, that we have to remember all of the grieving families who are out there. As for schools, I think we're continuously looking at other tools that are available, and test to stay, or a program where if someone is exposed to the virus, they're tested at certain intervals following that so they can stay in school, because we can pick up the disease early. And if we identify someone who's sick, have them go home and start the process over with those around them is certainly something that we've considered. But as we stepped up the new screening testing program now, allowing schools to opt in for cohorts, whether it's classrooms, teams, younger students, we wanted to get that in place first, see how it's working, see what the uptick is, see what our capacity is for doing additional testing before we add on other programs. But certainly test to stay, other methods that are working in other communities or states are things that we would like to look at. While we don't like to quarantine students and have them go home to distance learning, we know that that's an important tool in keeping COVID from spreading in the school. And so it is disruptive, but it's less disruptive than seeing COVID go on and spread through schools and lead to potential tragedies with students or teachers hospitalized or dying. So we want to minimize that. And that brings me to your next question. What can we do to reduce spread in the community? I think we have strong measures in place in the school settings to try and keep folks safe while they're there and keep the folks they return home to safe. But families, the other adults in those settings who come and go, the students, what they do in the community, the risks that they take that may expose them to COVID could show up in schools and could show up in increased cases or increased need for quarantine. But all of us have a role. If we could decrease the amount of COVID in the community right now by getting vaccinated, wearing our masks, rethinking the activities we're taking place in, we would see quarantine numbers in schools go down because schools are reflective of what's going on in the community. Yes, they will add some cases as large numbers of students come back to school, but they're not the driver of infection right now. They haven't been at all during the last year in Oregon. The communities are the driver of cases in schools. So all of us have a role, whether it's your child, your niece or your nephew, a neighbor, or you don't know any children. The actions you take to protect yourself and those around you are also going to keep kids in school in front of talented teachers. So I ask you all, to do something for yourself. You may be selfish because as a mother or a father, you're like, I just want to work from home and not have to help someone with their algebra homework. You may not be selfish. You may not know any kids, but the actions you're taking are going to keep those kids safely in school. So I ask us to come together as a community, and I know I've done this many times, but think about the risks you're taking because they impact not just you, not just your family and loved ones, but they impact everyone. It may be keeping kids in school. It may be keeping folks out of the ICU so that that hospital bed is available for someone else. But we need to come together as a community. We're in this together. Whether you agree with vaccination or not, whether you agree with masks or not, whether you agree with the politician in charge or not, whether you agree with me or not, know that the measures we take to protect ourselves work. Vaccinations work. Masks work. Limiting your contact with others works to prevent the spread of COVID. And if we all do that together, I can guarantee you that we'll see COVID rates come down in the state. We'll have more kids in school consistently. Our nurses and doctors can stop the frenzied pace they're in right now. My public health colleagues can get a little rest, and we can all move towards that sense of normalcy. Going out to eat without thinking about it, going to a football game or a soccer game or a concert without thinking about the risk of bringing it home. But we have to be in this together, and we have to know that the actions we take affect not just us, but everyone around us, and even people we don't know.
And just as a quick follow-up, how has uptake been on that screening program? And is there any kind of regional variation? Like, are we seeing schools in certain areas be more likely to sign up for that than schools and organizations in others?
I don't have the precise numbers, but we have schools re-enrolling in the school testing program for last year, and we're making very good progress on getting all those schools back up. We had about 90% of schools participating in that school testing program to identify sick individuals last year. As for screening, we have several districts and schools that have participated. They've kind of ranged across the state. I don't know about clustering, but hopefully we will look at that as we get more schools signed up and be able to, at a subsequent event, try and give you a little bit more picture of who's participating and who's not, so that families know about the activities their schools are doing to protect the students in schools, to protect the staff in schools. I just don't have that information in front of me.
Okay, thank you.
Thank you, Erin. And next up is Audrey Wheel, KPTV.
Hi, thank you. Two parts here. First, some of the national news right now, of course, is Idaho rationing healthcare because of their COVID situation. Wondering if we're taking in any patients from Idaho or if that situation is impacting us in Oregon in any way. And then the second thing, just following up on what some others have asked as we head into winter here, you mentioned that our current hospitalizations aren't sustainable, but then say, we do see the flu or another virus kind of making a comeback this winter. How concerning could that kind of a situation be for hospital capacity?
Thank you for those questions. Let me say, first of all, my hearts go out to all those in Idaho who are battling this virus, the people who are sick, their loved ones, the people who've been lost, those healthcare providers on the front line who are making very difficult decisions. We share a long border with Idaho, and that we have folks from Oregon who get sick, whose nearest hospital is in Idaho, and those in Idaho whose nearest hospital is in Oregon. I don't have precise numbers, but I know that people seek care at their nearest hospital, and that may be in a community that's on the other side of the state border. We are not in a place right now where we're seeing that same need for care and the same stretch on resources, but that does not mean that things are perfect here in Oregon. As I said before, we're seeing rationing of care, those cancer procedures for staging of cancer to determine next steps, those orthopedic procedures that keep people out of pain, and some other routine care is just not happening right now. Our staff, are working extra hours. We've pulled in additional staff who are providing care, at volumes and levels they never have before, and it's just not sustainable. Certainly, as we move into the winter, if we see a surge of influenza on top of our current surge, if the next surge of COVID or COVID and influenza is higher than this, that is going to strain our systems again. And we could wind up in a situation where we're doing even more rationing of care, similar to what our neighbors in Idaho are doing. We don't want to be there. Vaccinations long-term are our best bet for keeping COVID cases down. Influenza vaccinations are your best bet of protection against influenza. Other steps that we've taken over the last year, wearing our masks and limiting our gatherings, are going to protect against those. That's going to ensure that ICU bed with the nurse, respiratory therapist, and physician are there to take care of you no matter what you need it for, from COVID, a heart attack, a motor vehicle crash, or whatever you need it for. We all need to do something to reduce the level of COVID-19 right now. There are over 1,000 people with COVID-19 in Oregon hospitals as of this morning, many of them in the ICU, almost all of them unvaccinated. This is a choice that individuals made. These are preventable hospitalizations. And if we can prevent these unneeded hospitalizations, we can make sure that the care is there for all of us. Quality care delivered by skilled professionals is there across Oregon right now. That's not the case, to our neighbors in the east right now. Again, my hearts go out to them, and we know along the border, we have folks from Idaho who are hospitalized in our hospitals. We have Oregon folks who are hospitalized in Idaho hospitals. We're all in this together. We need to do what we can here in Oregon to prevent the spread of the disease, to keep people out of the hospital, to keep people healthy, and to keep people from dying. We've been doing it throughout this pandemic with one of the lowest death rates. We need to continue to do that to prevent the mourning and grief from increasing over the astronomical levels we're experiencing right now.
Okay, thank you, Audrey. And it looks like we might have time for a couple more questions before we end today's session. And so next with a question is Lynn Terry from the State's Newsroom. Lynn?
Hi, sorry, scrambling to get to unmute myself. Thanks for taking my question. Dr. Sidelinger, I'd like to ask you, what can you tell us about how much masks prevent transmission of the virus? And if you could talk a little bit about types of masks, if you have any information about that.
Thank you, Lynn. I think we have multiple studies about the use of masks that show they're effective. When we look in laboratory studies that do simulated breathing, coughing, and sneezing, we show that a barrier like a mask prevents the dissipation of the droplet particles that carry the virus out into the environment. And the same holds true in reverse. If there are droplets out in the air as you breathe in, that mask protects you. It's not 100%, and a lot of it depends on the material and the fit. So we ask that when you look at masks, you look for a couple of things. If you're wearing a cloth mask, 2 or more layers are better than 1. Medical masks that are made of paper or polypropylene are also very effective. And you want that mask to fit above your nose, below your chin, and snugly across your cheeks. Some things you can do to get that mask to fit better if there are gaps across your cheeks are to twist the ear pieces so that provides a little more flush piece there. To wear a cloth mask and a surgical mask together, that can increase the fit. To use a mask fitter inside your mask to allow it to fit better. But it's the fit of the mask, the material of the mask that can help prevent transmission. It's different in different settings, but as we look at the relationship between communities that implemented mask mandates and lifted mask mandates over the last year, there was a direct correlation with cases. As mask mandates went in place, cases in those communities went down. As they came up, cases went back up. Masks do work. They continue to work. Select your masks carefully, wear them consistently, and make sure they're well-fitting.
Thank you, Lynn. And with a follow-up question, Gary Warner, EO Media. Go ahead, Gary.
Hi, can you hear me? I wasn't expecting to get a second dip there.
We hear you.
I just wanted to find out what the game plan is on boosters. I've been noticing some statistics of third shots in the OHA numbers. What's going on with that? And if people want to get a shot, and a lot of people do, a third shot, when do you think they'll know whether or not they'll be able to do that?
Thank you, Gary. So let me talk a little bit about the vaccines that are out there and who's eligible right now. Right now, there are third shots available of the Pfizer and Moderna vaccines, the 2 mRNA vaccines, for those who are moderately or severely immunocompromised. These are individuals whose immune systems don't function normally and don't provide them the same protection. Their bodies may not have mounted the same quality response after vaccination that someone who wasn't immunocompromised offered. These are people who may have underlying conditions that cause their immune system not to work, advanced AIDS, beyond chemotherapy or other drugs that suppress their immune system. So right now, those people who are moderately or severely immunocompromised are eligible to get a third vaccine, a third dose of vaccine. And what we've seen in studies is that allows their immune system to mount a better response and gives them more protection. What we're expecting in the coming week or weeks is that we will have booster doses available initially for Pfizer. The FDA is meeting to discuss research later this week with our Centers for Disease Control and Prevention colleagues meeting next week. What we've seen over time is that there is some reduction in protection from vaccines. Protection still remains great against preventing hospitalizations and deaths, but it does go down a little bit. And we are particularly concerned about this in older folks, particularly those with underlying conditions who've been most severely impacted by this disease throughout the pandemic, making up a great proportion of our hospitalizations and deaths. And so I would anticipate that as the research is considered, those individuals who were eligible for vaccine first, among those our oldest Oregonians, will likely be first in line to get a booster dose. Whether that timing is 6 or 8 months afterwards, we'll need to hear from our federal partners, but we do anticipate over the coming weeks that booster doses will become available, starting with those who are vaccinated with Pfizer vaccines, likely followed by Moderna vaccines, and we are still waiting for information on a timeline for those who received Johnson & Johnson vaccines.
Thank you. We may have time for one more follow-up. Fedor Sarkin, Oregonian, a quick follow-up.
Yeah, sure thing. So, Dean, just wanted to go back to how OHA doesn't know how many schools are closing down or how many kids are quarantined. My understanding is that the impact on education plays a role in the decisions of what policies are or should be, like to figure out that balance. So how is OHA or OD going to do that, to figure out that balance if OHA doesn't know how many children are actually affected beyond the ones who are isolating because they're sick?
Thank you, Fedor. I think part of our work with schools over the summer and as we entered into the fall with schools returning is we told schools they need to be prepared to pivot. So as COVID affects their schools, they need to be prepared to offer distance learning for the students impacted, which could be a small group of students in a classroom, a whole classroom, a grade level, or a school. So they've had experience with distance learning over the last year. And we told them they need to be prepared to serve students with a model for that over a short period of time if they're impacted by COVID. So that's where the balance comes in. We want them to offer in-person instruction for all students every day throughout the school year, but they also need to be prepared to respond when COVID is in their community, have those tools available to provide educational services to students at home. It's going to look different school to school and district to district, with some being paper-based, some using cameras in the classroom to live stream to home, and some using other models altogether. But that has been part of the planning that ODE has done with schools throughout the summer and into the fall to prepare to pivot to offer different types of education for those impacted by COVID.
Thank you, Dr. Sidelinger, and thank you to all our media partners for joining us. Unfortunately, we are out of time, but if you do have